Sethi. So pregnancy can sometimes have an impact on a woman's eye health, and there are a few factors to consider. And today we have Dr. Sahebaan Sethi with us to discuss the same. Dr. Sahebaan Sethi is an eye surgeon who has been practicing at Arunodia Deseret Eye Hospital from past 12 years, and also she's a mother of two. So who well can explain being a mother herself, right? And perfect. So let's start with the first question, doctor. How does pregnancy affect eye health?
Right. Thank you so much for the introduction, Muskan. First of all, I'm delighted to be here, and I want to thank Tip Media and you for giving me this kind invitation. And I feel the topic that you've chosen for discussion is very, very relevant in today's day and time when so much information is available to everyone. For everyone to read, but then a lot of it is misleading, a lot of it is confusing, so it becomes extremely important for us to give direct person to person communication becomes very, very important in these times. And also everybody who is, I've been pregnant twice, and I know that, these are anyway stressful situations to start with. On top of that, if something does happen that you're clueless about, it puts a lot of stress on you. So it's good to know about the conditions of the eye that can affect you during pregnancy. It's good to be informed. It'll be good for mothers to be, or people who are pregnant, or maybe husbands who want to pass on the information to their wives. So yes, thank you for bringing up this topic. Right now, to answer your question, how can pregnancy affect vision? So it's very interesting because pregnancy brings about a lot of changes in your body, and these changes vary from increase in your blood viscosity. Your blood becomes thicker, your body retains a lot of water, so hormonal changes, of course. So all of these changes, they also affect the eye. Now, most of these changes, 80% of these changes, are thankfully physiological. When the body gets back to its normal after pregnancy, these conditions also get normal. And I'm talking about conditions of the eye, the physiological changes. But yes, there are certain conditions that one needs to be mindful about, which can be, vision threatening. And it's good to know about these. If you're experiencing any of that, it's important to, show to your eye doctor to see what exactly you are having. So when we start about conditions really that are affecting the eye during pregnancy, I would say, most importantly, women who are pregnant, they a lot of the times they complain that they can't really see as well as they used to earlier. Now, this happens to people who have glasses as well as to people who have never worn glasses in the past. They can feel blurred vision during their pregnancy, and this is the commonest problem we find amongst pregnant women. Now, why this happens is because the body is retaining water, and so is the cornea. The cornea is the black portion of the eye, which actually contributes to the refraction or the spectacle number of the eye. Now, when this also thickens because of retained water, the curvature changes, there are refractive changes that happen, and you can have exaggeration of your number, you can have variability of your spectacle number. Even people who have not had a number can develop a number. So this lot of variability is what accounts for the blurred vision. Now, you can get your glasses changed, but then there can be no, there will be no end to it. So it's best to wait until these changes, which are very variable, they settle down, and they settle down usually after you've finished exclusively breastfeeding. So they are not only limited to only the period that you're pregnant. It also continues on to the time that you are exclusively breastfeeding. So anyone who is looking forward to changing their number or wants to know why their vision is blurred, I would recommend that you hold on to 6 months after your pregnancy, which is when you're breastfeeding, to actually get your final number. There are also people who are looking to get LASIK done, for example. Now, even this, because your number is constantly changing and you don't really have a stable number, which is a prerequisite for anybody who's undergoing LASIK. So this is absolutely contraindicated while you are pregnant. So no laser procedures, no spectacle removal during your pregnancy. Another problem patients can feel is dry eyes. So a lot of the times women who are pregnant are feeling grittiness in their eyes, foreign body sensation, just general redness, dryness, and photophobia sometimes. So all of these problems could be a sign of dry eyes, which also is exacerbated because of the hormonal changes that are happening in the body. Now, what you can do about this dry eye problem is that you can get yourself some artificial tears over the counter. And if you feel better with them, you probably can manage. But if it still doesn't go in spite of you putting artificial tears, you should show to an eye doctor. Certain other things that we can do. See, I've been pregnant and I've had a lot of time at hand because we've been on maternity leaves, and naturally your screen time goes up. So you're watching your phone, you're watching TV all day long. So cutting down on the screen time will also help with these symptoms, which are grittiness, watering, redness, blurred vision, irritation of the eye. So all these signs of dry eyes, they also get exaggerated when you're looking at the screen constantly for a very long time. So give yourself breaks. Follow the 20-20-20 rule. Put some artificial tears which are available off the counter. Make sure you're using preservative-free ones. What you can also do is you can use some hot compresses. You can get these gel pads that are available that you just have to heat up and put around your eyes. Now, this hot fermentation also brings a lot of soothing effect to the eyes. So apart from this, what women can also see is a little pigmentation around the eyelids. Now, hyperpigmentation is something that is very common in pregnancy. Melasma is how we call it in the medical term. And there are creases that get dark. So it can be your armpits, it can be the back of your neck, and it can also be your eyelids. But the good part is that it does fade away. It may take several months after your delivery for it to get lighter, but it does. So these are some reversible changes that happen with pregnancy.
Okay. Okay, and there are any specific conditions or maybe concerns that women should be aware of during the pregnancy time?
Right. Yes. So apart from what is physiological, what is temporary, that usually will thankfully go away after pregnancy. Yes, there are certain serious conditions also that one needs to be aware of, and bring to a doctor's attention immediately as soon as you feel that you're facing any of these problems. And they can be blurred vision. Right now, blurred vision is probably the most important or the most dangerous telltale sign. And if it's not something as trivial as just a change in refractive error or dry eyes, it can mean something serious. So yes, now in pregnancy, we know that the pregnant women can have high blood pressure. Patients can have high blood sugar. They can have gestational diabetes. Since your blood is thicker, you can have a hypercoagulable state, and that leads to blood clots. And your blood clots not only just to the arteries and veins that supply the eye, it can happen to any part of your body. You're retaining a lot of water. So you can have retinal problems. So all of these problems are there. Now let's take a look one by one. So if we talk about high BP in pregnancy, it's a condition called preeclampsia, and it usually hits about 20 weeks onwards. And so what you can feel in preeclampsia is headaches. You can have, swollen hands and feet. You can have headaches which are as bad that they make you want to, it gives you nausea and vomiting. It can affect your kidneys. Now, all of that can happen. Now, how it affects the eye is that high BP can also affect the blood vessels of the eye, and that can lead to blurred vision. And sometimes this retinopathy, the hypertensive retinopathy itself, is a first telltale sign that the patient may be having high BP. So if you're experiencing any of these symptoms, it is a warning signal that you need to show to an eye doctor to rule out preeclampsia, get your blood pressure tested and treat it. Now, it is also a condition which usually settles down after pregnancy. Now, once the BP is kept under control, if and what it naturally comes down after pregnancy, the conditions in the eye or the retinopathy in the eye also tends to reverse. Okay, so it's important to diagnose high BP early and treat it adequately so that you don't have severe consequences because of that. Then, if there is a patient who is getting pregnant, maybe say older, and or if they have pre-existing diabetes. Now, in these patients, you can have a condition called gestational diabetes. Now, even gestational diabetes can affect the eye. Now, it also leads to breakage of the small vessels in the eye, and it can cause a diabetic retinopathy kind of a situation, which also thankfully is reversible. It can be kept under control as long as the sugar is kept under control during the pregnancy. Even after the pregnancy, once the gestational diabetes sorts of fades off, the eye problems will also go away with time slowly. So these are the two major problems that you can see and are very, very common in pregnancy. Now, apart from this, you can also have blood clots. Now, blood clots can affect your the retinal arteries or the retinal veins and lead to vascular occlusive conditions. Okay. Now, these can actually be sight threatening, and this can cause profound loss in vision. And it'll be hard to miss if you're having blood clots which have clogged your arteries or veins that supply to the eye, because you will have frank diminution of vision. Now, this is a medical emergency, and I will really not be able to, give a solution here over the phone. And I would recommend nobody to actually treat this just on the basis of what you've seen, what you've heard. Now, this is a medical emergency, and you need to show to an eye doctor if any of these conditions have occurred to you. Now, apart from this, what also can happen is if suppose you're suffering from, let's say, allergies. You can have allergic conjunctivitis. You can have seasonal allergies in the eyes. Now, normally the medicines that we would give to a normal person who's not pregnant is something that we cannot recommend or we cannot prescribe to a pregnant woman, which includes avoiding steroids, even the oral antihistamines. These are all contraindicated drugs in pregnancy. So one another heads up I want to give everyone is that please do not take any medications which are not prescribed to you. If you're going, see, it also happens very commonly that, you're in the early stage of your pregnancy and you don't really feel it's important to tell an eye doctor that you're pregnant, for example, and we end up starting you on an eye drop, which can actually go into your bloodstream and affect your baby or your pregnancy for that matter. So be very truthful about this, and it's always good to have a very open-ended conversation with your doctor. So discuss all the medications you're on. Even eye drops can actually enter your bloodstream and affect your pregnancy, affect your baby. So let's remember this. It's not just what you take orally that goes into your bloodstream. Even eye drops or any topical skin ointment, for example, if you're taking, can also enter your bloodstream. So all the medicines that you have been taking or you want to start taking during pregnancy has to be verified by a doctor. So apart from this, you can also have retinal problems, although which are rare, called CSCR. Now, this is a chronic serous chorioretinopathy, usually common in people who take a lot of stress, type A personalities. And so this is rare, although it does happen in pregnancy. And it will also be hard to miss because your central vision will get affected. So you will have like a black scotoma right in the center of your vision, or you will see wavy lines and distorted images. So these things things can happen. Now, also patients who have been pre-existing patients of glaucoma, for example. Now, how do you go about treating these patients in pregnancy also is not as simple as going through with your regular day-to-day medicines. Now, the eye drops or the anti-glaucoma medications that are prescribed are also, most of them are contraindicated in pregnancy. So be very mindful of what eye drops you are taking. Discuss with your doctor which is safe. There are also different medicines which are safe in the first few trimester. Those become unsafe in the last trimester. Again, different sets of medicines when you're lactating. So all of these things, they have to be discussed with your eye doctor. And also, when it comes to using contact lenses, I would say that it's best to avoid contact lenses for two reasons. One is that your eyes are extremely dry. So a lot of patients can feel that they are uncomfortable wearing their contact lenses. They feel intolerant, or they feel after wearing it, their eyes feel gritty and, the foreign body sensation. So if you do feel any of these symptoms, it's probably because of dryness, because of the increased corneal sensitivity. The cornea also becomes very sensitive to any foreign particle which is placed on top of it. So if you're feeling any of this, this is very normal. Now, avoid your contact lenses if you can, I would say. If you still have to wear it occasionally, I think you should use lubricating eye drops to make yourself feel a little better. And okay, barring the problem of absent-mindedness, the forgetfulness, it's extremely important to be very hygienic when it comes to taking care of your contact lenses. Don't sleep with your contact lenses. When you're applying your eye makeup, be careful of not damaging your contact lenses. Also, where you've stored the contact lenses, all of this also becomes very important. So it's risky, it's challenging, but still, if it's required, you can do it. It's not contraindicated. So I think, yeah, these are the few common conditions that affect pregnancy. And so just to sum it up, I think any blurred vision, any dryness, grittiness, foreign body sensation, if you feel the objects are looking wavy, if your peripheral vision is affected. So all of these, any headaches, for example, all of these conditions are things that you need to bring to medical attention and not take lightly.
Perfect. I think that was very informative for all our moms to be. And okay, so coming on to do you have any recommendations for eye exercises or habits, during one woman pregnant, which can also maintain a good eye health?
So I don't particularly feel that there aren't any eye exercises that can prevent you from anything from happening. But yes, there can be good habits that one can adopt. And since we discussed that dry eyes are probably one of the commonest things that we are all facing, and especially so gets exaggerated with pregnant women, you can probably adopt the habit of reducing your screen time, for example, taking short breaks, doing hot fermentation. Maybe the artificial tears will be your best friends. And apart from that, I think regular eye exams are very important. If you're suffering from any of these conditions that I'm talking about, I think a regular eye exam at every trimester of your pregnancy becomes extremely crucial. Even if not, you must have an eye exam. Any medications you're on, please get it verified by a doctor, even if these are eye drops. So these are just a few things. You can, of course, eating healthy helps. You can, reduce your salt, reduce fried food, reduce the amount of sugar you are taking. Now, all of this will probably limit your chances of having high BP or high blood sugar. Drink plenty of water. Although there is water retention in the body, it doesn't mean that you avoid drinking water. You take a lot of water so that it also flushes out the toxins from your body. That's also important. Eat healthy, eat fresh, lots of fruits, vegetables, all of that increase the roughage intake. So all of this will be good even for the eyes.
Perfect. So these were the some main questions wherein I guess you have covered almost everything. Okay, so now we have some few questions which have come from our community members, right? So before moving ahead to the questions, I would just like you and our be informed about our pregnant mother and baby health community, which we have on WhatsApp, right? And there we share our health information regarding the moms to be for pregnant women and also for baby health, right? So in case if yeah, every all the moms to be, we would just request you to, in case if you join the community, you can just drop a comment section. We'll definitely make sure that you get the link, or else we also have the link in our bio. Okay, moving ahead to the next question. Can I wear lenses in my third month?
So if you're talking about contact lenses, yeah, contact lenses are not contraindicated. But if you feel that you're finding it difficult to tolerate a contact lens on your eye, I think it's best to avoid it and not push it, because if you do develop infections or allergies related to it, any additional medication will actually be a burden on you, and we may not also be able to give you exactly the medications which will make you feel better because they are contraindicated. So if you're having intolerance problem with contact lenses, it's okay to avoid it, but it's absolutely fine to continue wearing it if you're mindful of the hygienic practices, if you're taking them off at night before you go to sleep, and if you're tolerating it well. It's not contraindicated in pregnancy.
Okay. Somebody has asked that I damaged my eye in my fourth month. Will it affect the baby?
So damaged meaning injured her eye.
Yeah.
So if you've injured the eye, no, it doesn't affect the baby. Anything which brings anything which is in your bloodstream is what is in direct contact with the baby. So no. Maybe even if it is as bad as losing your eye, it's not going to be passed on to your baby. No.
Okay. I feel a pinching pain in my eye in sixth month. What can it be?
So a pinching pain in the eye can most likely be dryness. Okay, so now in these conditions, like I said, just pick up the over-the-counter artificial tears. Now these lubricants are extremely effective, and you have very good preservative-free ones now. So pick them up, start using them. If you feel that you're feeling better, maybe use them 2 to 3 times a day. If you're feeling better, it's most likely dry eyes, which gets exaggerated when you're probably sitting in front of a blower or under the fan. So yeah, if these things are bothering you, if light sensitivity is bothering you, if you feel your eyes are red and gritty, if there's a foreign body sensation, a lot of the times people also confuse pain with grittiness. So that's also one differentiation that you need to make. Is it feeling gritty or is it actually pain? Pain could mean different things, which needs to be examined. But if it's feeling gritty, it's most likely dry eyes, which should settle with artificial tears taken off the counter. If it still persists, again, I would say don't take a chance and show an eye doctor.
Okay. Okay, coming on to the last question for the session, do we have any, anything that you can help in promoting, anything that we eat can help in our eye?
I'm sorry, I didn't get the question.
What can I eat to promote my eye health when I am pregnant?
Oh, okay. I think we covered that. Drink lots of water, have low salt diet, keep your sugar low, keep your BP low. The salt intake, the sugar intake, all of that can be kept under control. There isn't really any food that is going to be helpful for keeping your eye diseases at bay during pregnancy per se specifically. But yes, eating healthy overall is good for your general well-being, even for the eye. Lots of vegetables, fruits, healthy, clean, roughage included diet for the pregnant women.
Perfect. Thank you so much, Dr. Sahebaan. That was all from our end. Thank you so much for joining the live session. And before
Thank
we
you
end
for
the
having
session,
me.
absolutely. Okay. Before ending the session, I would just like to inform our audience that at Thip Media, we are dedicated to delivering expert health information for you and for your well-informed choice. Avoid relying on any unreliable information that is found on social media. Also, you can follow us on our Instagram and on WhatsApp and other social media platforms. Remember, when you know better, you live better. Thank you so much again, Dr. Sahebaan.
Well said. Thank you so much for having me.
Thank you, ma'am. See you. Bye-bye.
Bye.